Hello and welcome to Just Therapist Things, where we talk all things therapy. My name is Jordan and I'm a licensed marriage and family therapist from sunny California. I am the private practice owner of Vital Mind Therapy. I lead support groups at a cancer support nonprofit, and I am the new author of the children's book, Anxiety in My Body. Thanks for listening. Hello all, glad to have you here today. This episode is on assessments that MFTs, marriage and family therapists, and other counselors with similar degrees can do. So I have been thinking about implementing some sort of assessment in my practice because I think it's a great way to supplement clinical work and do something that is more administrative and tangible. But marriage and family therapists and other counselors with similar degrees can't just do any assessment. And it's kind of hard to figure out what kind of assessments we even can do. So I did the research so you don't have to. Let's get into it. Assessments that are used in mental health are important because they are a way to understand symptoms better, possibly to get a diagnosis and to form a treatment plan. Assessments can include questionnaires, checklists, self-report surveys, surveys from family and friends, other professionals, observational data, clinical interviews, and even medical records. It just depends on the test. MFTs and other counselors actually do assessments regularly, especially when meeting new clients and also when ensuring client safety. When meeting new clients, it is necessary to do a clinical interview assessment, which can be structured or unstructured. And this is a tool that is used to gather information about a client's current symptoms and functioning, as well as history. An initial clinical interview always includes a mental status exam, or an MSE, and the purpose of this is to assess current emotional behavior and cognitive functioning. And some components of this observational assessment are observing a client's behavior, as I said, appearance, speech, mood and affect, thought content and processes, if there's any hallucinations or delusions, and their insight and judgment. Any type of clinician, mental health, medical health professional meeting with any client should always do some sort of clinical interview assessment and mental status exam prior to beginning treatment and also throughout treatment. When people think of mental health assessments, the ones that come to mind are usually ones that MFTs cannot do, such as personality disorder tests and cognitive ability or intellectual tests. These types of assessments are in the categories of psychological testing, neuropsychological testing, or psychoeducational assessments, and I will go over these in more detail in a moment. So these are the main categories of testing, but there's many similar tests that are used in each category, and there's also various different ones because you have to have certain degrees to do these types of testing. And again, I will talk about that in a moment. These types of assessments are usually pretty costly. They're usually pretty long. They could take hours or days, and they are tests that are needed for an official diagnosis or accommodations for school or work. And usually these assessments include a full battery of multiple different tests in the full assessment, and this is of course based on the needs of the individual. These tests are very helpful to inform treatment, and I have many times over the years referred clients to get further testing done that I cannot provide. And this was in order to guide my own therapeutic treatment, in order to get them a diagnosis to better help them and then refer on to medication or to help them in things like school or work with getting accommodations. And with the different types of degrees that can do these tests, like psychologists, neuropsychologists, educational therapists, and such, these people, sometimes they only do testing in their practice, and sometimes they also do testing plus therapy or testing plus diagnosis and referral for medication. So it really just depends on the person, but you have to make sure that you have the appropriate license and are properly trained and credentialed in order to do any assessment. There are also tests in these 3 separate categories that MFTs can do, or we can do similar tests, again, if we are trained or credentialed in them. It can be a great idea for MFTs or other counselors to implement some sort of assessment in their work if, of course, you are interested in it, and this would be to better help clients, to supplement your income, and also provide another avenue of work besides just clinical work. Depending on the type of assessment, more training or certification may be needed to do a certain test with clients. Disclaimer, there are so many different types of assessments and tests, so I will absolutely not be covering all of them, but I will touch on some of the more commonly used tests and assessments. So first, let's start with psychological assessments. Psychological assessments are structured evaluations that include intelligence tests, personality assessments, neuropsychological tests, or projective tests with the purpose of guiding treatment, assessing cognitive and emotional functioning, and to diagnose mental health conditions. The people who are qualified to do psychological assessments are psychologists and psychiatrists. As a reminder, the difference between psychologists and psychiatrists is that psychiatrists are trained in medicine as well as mental health, so they can prescribe medication, and they have an MD. Psychologists are clinically focused and either have a PhD or a PsyD and are not trained in medicine, just in mental health. Psychiatrists use psychological assessments, medical tests, and specific psychiatric evaluations to guide their treatment, whereas psychologists cannot use medical tests or prescribe medication. Some of the most common psychological assessments, and ones that you may have heard of in psychology books and from famous psychologists who invented these, are personality tests. And some of the most common personality tests are the Myers-Briggs personality test, the Rorschach Inkblot test, and the MMPI, or the Minnesota Multiphasic Personality Inventory. Psychological assessments also include tests for ADHD, such as the Vanderbilt Assessment Scale, the Conners Rating Scales, and also a common one for autism is the ADOS, or the Autism Diagnostic Observation Schedule. So just out of those that I mentioned, MFTs cannot do the ADOS for autism screening. We cannot do the MMPI for personality disorder diagnosing, and we can't do the Rorschach Inkblot, oh my gosh, say that 5 times fast, Rorschach Inkblot test for exploring thought processes and emotional functioning. We can do kind of a general mood, behavioral, feelings questionnaire, and this is called the MFQ, which just stands for the Mood and Feelings Questionnaire. And this is a self-report test, or it's done by parents or caregivers to assess depression in adolescents and children and other mood, behavioral, or feelings concerns. We can also do the Vanderbilt ADHD Diagnostic Rating Scales, but we do need higher credentialing to do this and training in this. And this screens for ADHD, anxiety, depression, and also conduct disorder and oppositional defiant disorder. But this test just generally assesses for the severity and impact of ADHD symptoms. We can also do the Conners Rating Scales, which are used to assess ADHD, and this is for kids. We can do a behavior assessment for children, or the BASC-3, and this is used to assess behavioral, social, and emotional functioning in children. And we can also do the Myers-Briggs personality assessment, which is something, you can find it online. You can Google it and just take the test for yourself. And this is not a diagnostic tool for personality disorders, but it's just a way to understand personality types and preferences. So that could be interesting to use in session. But a lot of these, as you can tell, are really just dependent on the need for doing the type of assessment. So you don't just want to whip out one of these assessments just because. You could do that with general assessments that I will talk about in a little bit, such as the PHQ or the GAD assessment or the audit. And those are kind of just generally for anxiety, depression, alcohol use. But these more specific ones for ADHD, personality, mood stuff, executive functioning, behavioral assessments, you really only want to use these if it's clinically appropriate and not just for fun. But the ADHD ones as well. This is not a diagnosis for ADHD because MFTs cannot diagnose ADHD, but this could be just a supplementary test, just to kind of see if ADHD is indicated, and then you would need to send the kid or the adult for further testing and to a psychologist or neuropsychologist for a wider variety of testing to diagnose. And again, this is not a comprehensive list, but these are just kind of popular ones and ones that I pulled to inform you on tests that MFTs can do. Next is neuropsychological assessments, and these are different because they are done by neuropsychologists. So doctors who specialize in brain functioning, brain-related disorders, and neurological conditions. Neuropsychological testing is to measure cognitive abilities related to language, memory, and other mental processes, and also diagnoses of brain injuries, Alzheimer's, dementia, epilepsy, developmental disorders, ADHD, and more. The categories of these tests to support or diagnose these disorders are memory assessments, executive functioning assessments, attention or concentration, language, motor function, and visual spatial assessments, among others. Some of the most common neurological assessments are the Wechsler Adult Intelligence Scale, or the WAIS, and the Wechsler Intelligence Scale for Children, the WISC. Both of those measure memory, processing speed, and general intelligence. There's also the Wechsler Memory Scale, which assesses for specific memory problems, the Ray Auditory Verbal Learning Test that evaluates verbal learning and memory, the Children's Memory Scale, the Stroop Color and Word Test, the Wide Range Achievement Test, or the RAT, the Behavior Assessment System for Children, or the BASC, and the Montreal Cognitive Assessment, or the MoCA. MFTs cannot do the full batteries for the WAIS or WISC or RAT. We cannot do the Wechsler Memory Scale, the Stroop Color and Word Test, or the Ray Auditory Verbal Learning Test. We can, however, use parts of these tests or screenings to inform therapy, but not diagnose. We can do basic behavioral observations in memory, fluency, and daily functioning. We can do basic attention or memory screeners like the MoCA to identify preliminary signs of memory loss. We can also do the digit span that is part of the WAIS or WISC for working memory or attention. And we can also do academic or functional questionnaires such as BRIEF, which stands for Behavioral Rating Inventory of Executive Functioning. As I mentioned, in psychological testing, we can also do the BASC, the Behavior Assessment for Children. So to conclude, MFTs do not diagnose neurological or neurodevelopmental disorders through formal testing, but we can contribute valuable behavioral and relational observations as part of a team to support a client. Similar to psychological and neuropsychological tests are psychoeducational assessments. And this is basically what it sounds like. It is psychological testing that has an educational academic component. The MFTs are not trained or licensed to do these full assessments or full battery of tests, but we can, similar to the other ones, do parts of them. People who commonly do psychoeducational assessments are general psychologists or specific educational or school psychologists. Psychoeducational assessments are used to measure cognitive abilities, academic achievement, and emotional behavioral functioning in the context of developmental challenges or learning disabilities. Honestly, a lot of the assessments that I've already mentioned are also part of psychoeducational assessments, like the WISC, like the RAT, like the Connors, like all of those things. And particularly ones that fall into the categories of cognitive ability tests, academic achievement tests, executive functioning, and memory tests. Basically things that would help you in school or in work or in some sort of academic setting. These tests can be very useful for. Behavioral tests are also a part of it. And so instead of repeating all the tests that are part of psychoeducational assessments, it's honestly all of the ones that I already mentioned. So I won't be repetitive, and you get the gist. So now let's talk about what assessments that MFTs can officially do and when it may be indicated in a session. As I mentioned initially, we always do clinical interview assessments and mental status exams to identify initial functioning and or risk concerns. Some of the initial screening tools that we use are the PHQ-9 depression screener and the GAD-7 anxiety screener. These are short self-report surveys that a lot of counselors and therapists use at the start of treatment just to get a baseline for a client's anxiety or depression prior to starting treatment, and these can be reviewed or retaken throughout treatment. Similarly, the Beck Depression Inventory and the Burns Anxiety Scale are very commonly used, and these are more comprehensive screeners and indicators of the severity of depression and anxiety. Again, these can be used at the start of treatment and throughout treatment. A type of client that may need a Beck or a Burns is a client that is potentially exhibiting signs of depression or anxiety, and you are unsure if that's what it actually is, or a client who it is obvious that they have anxiety or depression and you want to know more about the severity or the specifications of it, the specific symptoms that are popping up. These tests can and should be used throughout treatment to monitor a client's progress. So you can use them every month, every 3 months. You could just use it as it is clinically appropriate. MFTs also regularly use the audit, the alcohol use disorders identification test, to measure alcohol use, and MFTs also regularly use the audit, the alcohol use disorders identification test, to measure alcohol use and identify the need for potential further evaluation. It is a good idea to use this with the client if you suspect alcohol use or you want to measure frequency and severity. And some of the most typical assessments that you would think that MFTs would do, because MFT is marriage and family therapist, these are marital satisfaction inventories or parenting and family types of assessments. And these are assessments that focus on family functioning, relational dynamics, and individual functioning within a family or within a system. And some of these assessments are the Parenting Stress Index, the Couple Satisfaction Index, the Family Assessment Device, or the Parenting Stress Index. So these are all things that we can use with clients or families and we can use in session. And these are indicated, I would say, at the start of treatment with a family or with a couple, specifically a couple that is working on their marriage or parenting, things like that, because they are just initial assessments to measure functioning and to measure dynamics within a relational unit. These are also assessments that can be done at the start of treatment and throughout treatment as needed and as indicated. We can also do trauma symptom checklists in sessions, such as the PCL-5. There's more specialized screeners such as ACEs, which stands for Adverse Childhood Experiences Questionnaire. There is a trauma symptom checklist for children or a trauma symptom checklist for adults. And these trauma assessments are to screen for indicators of trauma or any adverse childhood experiences, any traumatic experiences that have happened for a child or for an adult. And they're also used to screen for symptoms of PTSD, which we can diagnose. We can also conduct risk assessments, and we should always conduct risk assessments if we feel it is necessary, such as the Beck scale for suicidal ideation, the danger assessment, and the risk assessment checklist. These are, of course, to identify risks if there are any suspicion that a client could be a danger to themselves or to someone else. It's very necessary to do some sort of risk assessment or just a basic suicide assessment identifying intent, means, or plan for suicide or for homicide or just any other risks that are coming up. Other kind of more general assessments that are used to monitor therapeutic progress and I guess the process too, but mainly the progress, are rating scales, such as the outcome rating scale or the session rating scale. These are pretty self-explanatory, and they're just used to track session progress and outcome progress over time and assess well-being over these specific areas of functioning. They're also used to assess the quality of the therapeutic relationship from the client's perspective, because these are all self-report scales. And lastly, and repetitively, although these assessments that I'm about to discuss are most commonly done by psychologists, neuropsychologists, by psychologists and neuropsychologists, MFTs can also do specific tests related to behavior assessment, cognitive abilities, learning abilities, and executive functioning for support in the treatment of a client, not for the diagnosis, just the treatment. So for all of these that I mentioned, and these are the ones that I talked about for most of this episode, we can do part of the test. So like we could do the BASC, the memory screener, the Conners test. We can't do a full battery of psychological or psychoeducational testing, but we can do some of the tests, of course, if we're trained and credentialed. And this is just to indicate that there could be a memory, behavioral, developmental, learning, executive functioning, etc. concern, but not to diagnose one, because we can't. We're not allowed to diagnose those. Thanks for listening to this long-winded explanation of what assessments MFTs can do. I hope it was somewhat helpful to those thinking about or interested in assessments. Thank you for listening to Just Therapist Things, where we talk all things therapy. I'll talk to you soon.